Shall we begin?
Very good evening.
Good evening, sir. Good evening.
Yeah, how are you?
Fine, sir. Doing good. How are you, sir?
Good. So,
Tech team,
Ma'am,
shall we begin?
yes, ma'am. We are live.
Yeah, thank you so much. So, on behalf of Endocrine Society of India, it's my pride and privilege to introduce Dr. Shubhankar Chowdhury, sir, one of our endocrine stalwarts. So, sir is a former professor and head of the Department of Endocrinology at IPGMR and SSKM Hospital, Kolkata. Sir is currently the head of the Department of Diabetes Metabolism of Endocrinology at Manipal Hospitals, Kolkata. Sir is also the chairman of Institutional Ethics Committee at Institute of Neurosciences in Kolkata. Sir is a past president of Endocrine Society of India and also a past editor-in-chief of IJEM Journal. On behalf of Endocrine Society of India, we welcome you, sir, to this Facebook Live program.
wonderful occasion. Thank you very much for getting me in.
Thank you, sir. May we start, sir? Shall I ask you a few questions to clarify doubts of general public regarding obesities?
Yes, sure.
Sir, it is well known that obesity is a metabolic disorder. So, people know that often diabetes is associated with obesity, hypertension is associated, and dyslipidemia. What are the other disorders which are commonly caused by obesity or associated with obesity?
Right. Can I just get back? You stated very appropriately that obesity is a metabolic disorder. Can I just sort of extend it and say it's a neuroendocrine disorder?
Yes,
Meaning
sir.
to say that when we see people who are obese, we often put it down to thinking or even remarking that it's because of lack of willpower, or you have not been able to control your diet, so you're obese. But it may not be just that. There may be things happening in the brain itself which determines how much we eat, when do we get satisfied after eating certain amount of food, and all those. So and there's a very tiny area inside the brain, the hypothalamus, which weighs possibly only a few grams, but determines so much of what we do and how we do. And so it's problems at the hypothalamus which may be driving much of what eventually results in obesity and all the metabolic disorders that it entails. And we all know that obesity is a major problem today across the globe. And though we say that we are, let's say, developing nation, and poverty, undernutrition are important issues, but surprisingly, obesity is also a very major health problem, which uh, only very recently, I think, even at the government level, at the national level, we have accepted that, and we really need to address it on a broader level. Not just you, I, just a few physicians will be able to solve it, right? But coming down to your very important question is to why should one be concerned about obesity beyond just the cosmetic aspect? Some people may be actually embarrassed to be carrying around such a lot of weight. But beyond that, really, there are so many different conditions that are linked to, that are likely caused by obesity. And today, in recent times, it's suggested that uh, we look at obesity as as a risk factor for different diseases. And then we look at obesity, which is now associated with various diseases or conditions or dysfunction of different parts of our body. When we have those additional conditions, then only we call it clinical obesity. And then only we suggest that we are really very sort of pumped up. We feel the urge to treat obesity on a very uh, uh, sort of aggressive manner, including possible use of medications to treat obesity. But the diseases, there are many. You have mentioned diabetes, hypertension. dyslipidemia, which all do sort of convert into a significantly higher risk of what we call cardiovascular disease, which result in heart attacks, which result in strokes, which result in heart failure, which result in heart arrhythmias, which can lead to sudden death as well. Those apart, there are now understood that obesity does lead to something which is now common parlance, fatty liver disease. And in fact, today, if we look at worldwide figures of the need for liver transplant, means the liver has gone so bad that you need to change the liver. The two most common causes are not any longer the hepatitis B and C. Those are very important. But today, the two most important reasons are alcoholic liver disease, and that is possibly in certain populations, not widely, but this fatty liver disease. So liver disease also is related to obesity, which may not be known as much as the other conditions like diabetes, hypertension. Then kidney disease, chronic kidney disease can just be because of excess body weight. And then, of course, there are other issues like osteoarthrosis of the knees, knee problem, back problem. Those can be because of obesity. And we are now understanding a whole host of new conditions related to sleep, the obstructive sleep apnea, as we call, where the breathing gets interrupted during the night and leads to a whole lot of other problems. That apart, we understand quite a few cancers are very strongly related to being obese. So obesity can affect practically any organ, any part of the body. Sorry, I made it too long, possibly.
No, sir. It's exactly. It's you have covered all the points.
Yeah.
So also, sir, I would like to know that in recent studies shows that our fat cells or the adipose cells also secrete certain hormones, which are called as adipokines and lots of other hormones, which can be detrimental to our body. So, can you please elaborate on the effects of adipose tissue as a hormonal producing organ in the body?
Uh, yes, I could possibly, but maybe our audience this evening may not be that much interested in all those details. But nonetheless, we at least need to know that fat is no longer just a cushion that
Yes,
you may use.
exactly, sir.
Even if you do not have a mattress, you have the fat to lie on. Well, it's beyond that. And the fat cells, as you mentioned. So if what we consider as fat consists of numerous cells inside, and those cells are very active and they produce different chemicals which have different functions. And many of them have adverse effects on the body, can cause inflammation, can cause insulin resistance, and so on. But there are some hormones secreted by fat cells which are of a good nature. So we would like more of that to come out of the fat cells rather than the bad ones. Now, it is also peculiar, maybe, that obese people who have more fat should therefore also be producing more of the good hormones. But unfortunately, obesity typically is associated with lower levels of some of those good hormones like adiponectin. That's one at least. And why that happens, we don't exactly understand, but it's possibly related to the type of fat cells. Certain types of fat cells produce more of this adiponectin, others do not produce. So when you get fat, maybe you get more, or excessively fat, I mean, you get more of the unhealthy type of fat cells, which are more adept in producing the harmful chemicals, the inflammatory cytokines, we call them, and less of the favorable ones like adiponectin.
Sir, you have simplified a complicated topic very well. So, likewise, you said, can you elaborate which is good fat and which is bad fat in the body, sir?
Right. So here we can look at sort of the forest as a whole, or we can look at the individual trees, so to say. So if we look at the forest as a whole, when we say fat is bad, uh, the fat is located all around in the body. What we can directly see is fat, maybe in the arms, in the trunk, in the legs, and so on. Uh, and that is subcutaneous fat, just underneath our skin, the fat that is there. But there's a whole lot of fat within our body, inside our body, which we cannot see. It can be around the heart, it can be around the kidneys, it can be around the intestines, inside our abdomen, it can be inside the eyes also, or around the eyes, around the globes of the eyes. So we broadly differentiate fat on a gross sense as subcutaneous fat, which is immediately under the skin, and visceral fat or abdominal fat, which is inside the abdomen. By and large, excess visceral fat is known to be bad, whereas subcutaneous fat possibly is not so bad. Actually, what happens is when you eat more than what you spend, just as when you earn more than what you spend, your bank balance grows. So does your body. When you are eating more than what you are exercising, your body grows, and that growth is majorly because of excess fat deposition. Now, fat would normally get deposited in different parts of the body, especially under the skin. But there is a limit to which the fat can be deposited in those organs, or in those parts. Once you exceed those limits, if you do not respect those limits and go on eating more, then the excess fat tends to get deposited elsewhere, which is known to be more harmful. And that fat is much of the fat that we see inside the abdomen, including inside the liver. And we talked a little while back about fatty liver disease being a major problem. So excess liver fat is also bad. So broadly, fat inside the abdomen is bad. Fat under the skin is not so bad. Then on a microscopic level, if you look at the fat cells, because you talked about the fat cells producing different hormones and chemicals, there again, those cells, you can have two types of fat cells. One are the mature fat cells, which are relatively small in size. You'll have small droplets of fat inside them. And then you can have the large, sort of mature fat cell, which has fully filled with fat inside. Here again, the mature fat cell is the one which is better, which is the one which produces more of this healthy hormone or adiponectin. And the immature fat cell, the bigger fat cell, full of fat, which is the one which produces less of adiponectin and more of inflammatory markers, interleukins and TNF alpha, and so on and so forth.
Yes, sir. Sir, also you have a very vast clinical experience. So you might have seen quite a lot of patients. And have you noticed that any difference if two patients come to you, two individuals with the same illness profile, like whether it is severe infection, sepsis, or coronary artery disease? Many a times we see that the person with obesity has a comparatively bad prognosis compared to a person without obesity. Is that true in a routine clinical practice, and why is that so, sir?
Right. So I think that's true. However, if you look at evidence, uh, you will find that there is something called the obesity paradox. So people who are getting admitted to the intensive care unit, ICU, it's been shown by in a number of papers that obese individuals, not grossly obese, but significantly obese individuals, tend to have lower mortality compared to the non obese ones. That's surprise. And mostly, I feel there are limitations in the design of the study, interpretation of the study. I feel, yes, if you are more obese, you are likely to get, and that's what I have seen most of the time, uh, uh, more complications, more difficulties if someone has to be hospitalized, longer hospital stay, and likely even more mortality in those individuals. However, if we take uh, very lean individuals, very underweight individuals, they also will have more complications. But if we take absolutely normal weight individuals versus obese individuals, I feel that the obese ones definitely will have more complications, and that's because the obesity has not come just on its own. It has come with its own package of blood sugar being high, blood pressure being high, heart being not working well, liver not working 100%, kidneys being affected. So, because of all these other associated problems, the complications tend to be more, the recovery tends to be worse in these situations.
Sir. So you have already mentioned that more in individuals with morbid obesity, there is a risk of fatty liver disease and early kidney damage, which can be independent of the associated diabetes. And so, how do you recognize this problem in individuals? What are the clinical features that people should be aware of, and how do they screen for it?
Uh, well, I think people at the population level, people level, we should not be allowing them to go onto the stage to detect their own diseases as such. They should make sure that they do not cross their whatever the limits in terms of the obesity. And I would just like to see, because we discussed about uh, abdominal fat or visceral fat. Now, a common person, how does he or she now how, assess how much of visceral fat there is? There's no easy way. There are methods for which maybe bioelectrical impedance, DEXA, CT scan, those are all sophisticated investigations. But simple waist measure can give you some idea. So if you are a man and Indian, then our limit is 90 centimeters. So your waist size, trouser size, if it's more than 90 centimeters, then you are likely to having more of visceral fat or abdominal fat. If you're a woman, then again, the waist circumference, the limit set is about 80 centimeters. So these are ways that you can look at. And of course, you can look at your body weight, your height, and estimate your body mass index. Beyond that, it needs some assessment, investigation, clinical examination. Maybe the doctor on examination can find the liver being enlarged, the liver being unusually firm. And then, of course, there are tests which can detect either some liver or kidney dysfunction. So these would be the early hints. And then one has to take recourse to remedial measures.
Yes, sir. So, compiling that together, the patient should not be treating themselves and should go to their endocrinologist for a proper assessment and to be taken care of the illness.
Yes, yes.
And also, we would like to know, sir, what are the risk of morbid obesity contributing to our current cancer epidemic? What are the cancers we usually see along with obesity?
Yes, that's again a part that maybe many people, general people, would not be aware of, that there are so many cancers which can be very strongly be associated with obesity. And these could again be anywhere in the body. But I think the ones most strongly related to obesity are breast cancer, especially postmenopausal breast cancer, uterine cancer, endometrial cancer, liver cancer, related to fatty liver disease, actually, kidney cancer, and also colorectal cancer. These are well known to be associated with obesity. But the issue is, if someone is detected, let's say, with a breast cancer, do we have evidence that if you reduce the body weight, and let's assume that lady is obese, if you reduce the obesity, does the breast cancer get smaller? Well, it doesn't, because there is a point beyond which just losing your weight does not help. You need to have other treatment. But definitely, if you prevent the obesity from happening, you can reduce the risk of several of the cancers in our body.
Sir. Thank you, sir. That is regarding the malignancy part. And also, sir, many a times people living with obesity always feel tired. Whatever they do, how much rest they take, how much sleep they get, they always feel tired. Many times they will have snoring and all those complications. So, obstructive sleep apnea and another closely related entity of obesity hyperventilation syndrome is very common in the individuals, but people are not aware of it. Could you please elaborate on this?
Yes. Uh, Thank you very much for raising this issue of obstructive sleep apnea, which I may not have initially discussed when you asked about what are the problems that you can get with obesity beyond diabetes and hypertension. So this is being increasingly recognized. So obese individual feeling tired, most commonly one would do a thyroid test. And the thyroid test, let's say the TSH level, the most commonly done test, let's say the upper limit of normal is 5 and it comes out at 7. And the patient is very happy that I've now got the cause for my obesity. Now I'll get it fixed, easy, and go to the doctor. And if that doctor happens to be you or me, that patient will be a little bit disappointed, because we do know that this mild elevation of the TSH, slightly abnormal thyroid function test result, does not really explain the obesity. Rather, if you're grossly obese, because of being obese, your TSH level could be a little bit high. So if you are able to lose the weight by any which way, your TSH may come down to normal also. On the other hand, by taking the tablet of thyroid hormone replacement, your TSH may come down, but please do not expect the obesity to go down just because you've taken those thyroid tablets. Yes, thyroid deficiency, if it is significant, it can cause some weight gain, but that is by a few kilograms, by 2, 3 kilograms possibly, not 10, 20, 25, 30 kilograms. So beyond that, we should now be aware of the various other conditions. One is this obstructive sleep apnea, which is a condition where during sleep, normally, actually, we have the airway, the air passages that go into the lungs. And when we breathe, the air that we breathe goes through those air passages to the lungs. And from there, the lungs extracts the oxygen and takes it and then distributes to the rest of the body, to all the cells in the body which require oxygen. Now, normally during sleep, the muscles tend to relax a little bit. And so there is a natural tendency for the airways, especially the upper airways, to collapse when you are sleeping. But if you are obese, especially if you have a thick neck, meaning you have a lot of fat in the neck, you are also likely to have a lot of fat just around the upper airway. And so that itself can narrow the airway And on top of that, when you're sleeping, if the muscle relaxes further, then the airways could collapse. And that could cause obstruction to your breathing. That will cause lack of oxygen supply from the lungs to the rest of the body, and importantly also to the brain. So during sleep, the brain sort of gets, let's say, recharged, if we use simple language. And that requires it to be constantly supplied with its nutrition, with its oxygen, and all that. But if it goes on getting deprived of oxygen, then it doesn't get restored properly. The normal restorative property of sleep is lost. Therefore, and thereby, in the day following a night's sleep, during which there were multiple episodes where this breathing got obstructed, therefore the oxygen supply to the brain got obstructed, you have a non-refreshed brain, and so you tend to feel tired, weak, and as a consequence, sometimes, often, you feel irritated, you feel depressed, you maybe you are not able to work up to your 100%, whether you are a student or you're working at any place. So all these problems can arise. And what happens is, normally, once the oxygen level goes down, the brain also gets to know that oxygen level has gone too low. And then it activates a process so that that obstruction can now be relieved. There is now a more conscious effort at breathing, and then the breathing again starts. So this goes on and off, and many a time it may not reach conscious level. You may not be aware that your breathing is stopping. You may not be sort of aware that your sleep actually is getting disturbed, because it happens for a few seconds only. Sometimes the partner notices, because of this obstruction, there is loud snoring. Sometimes the partner can notice that sometimes the breathing gets paused, or sometimes the person gasps for air. So all these can be noticed, but sometimes it is just seen in the form of excessive sleepiness, tiredness the next day. The other part is, this is what happens during sleeping. But if you are severely obese, then there is something called hypoventilation, where you tend to breathe, have rather shallow breaths and rapid breathing during the daytime also. So the function of the lungs, one I said, was to bring in oxygen from the air and supply it to our body. The other part is to push out carbon dioxide, which all the cells produce carbon dioxide, and that has to be pushed out through the breath. So in this condition, this carbon dioxide cannot be pushed out, and so it builds up inside the blood, and it again also leads to tiredness and weakness and all the problems. So both these conditions are very strongly related to obesity.
Thank you, sir. So it is well known that obesity causes osteoarthritis of the knees, and many times when somebody is advised surgery after losing the weight, we are able to avoid the surgery also. So what are the other mechanical, what are the other mechanical complications of obesity?
So osteoarthritis, so the knees are most important, but that apart, back problems are very common. Then there is chronic venous insufficiency in the legs, varicose veins. Those are problems. Sometimes it can be very bothersome. Uh, and beyond that, if you look at the other sort of mechanical problems, uh, the mechanical problem of carrying the excess body weight itself can be an issue, and a common reason for person getting short of breath very easily without there being any actual problem with the lungs or the heart. When you're short of breath, people tend to think there's a problem with the lungs or the heart, but many times those can be fine, but still the person can be short of breath because he or she has to carry so much 20 kilograms of extra body weight all the time. So these are, again, other facets of excess body weight affecting the functioning of the body as well.
Yes, sir. Uh, Sir, also some people have spine problems, and
Mhm.
is there a direct correlation to that, sir, because of this back pain?
Yeah, I did mention back pain is an issue. Yes, and you can again also elaborate on it if what's in your mind. Yes, please go ahead.
No, no, sir. I was just asking
No,
because the people
no, no.
tend to
Yeah.
like lean forward and walk like
Okay,
this,
okay,
like pregnant women. So they tend to have
okay,
back
okay.
pain
Right,
many a
right.
time.
Yes, yes, yes. That's true.
Sir, sir, also, sir, recently we have already, sir, you have spoken about the body mass index and also about the waist circumference, which is a simple test that people can do. So, is these are not foolproof methods, as we know, sir. So, what are the other methods? What are the other methods of detecting obesity in an individual?
Right. So obesity is a problem primarily because of excess body fat. And when we are measuring the body weight, we are measuring not only the fat, but also the muscle, the bone, the water, everything. So if someone is very waterlogged, someone with kidney failure, and the kidneys are not able to take out the water from the body, so there'll be at least 5 kilos or even more amount of water in the body. There also the BMI will be somewhat high, but there it's not a matter of increased body fat. Similarly, there can be certain conditions, even we see in endocrinology, certain conditions where the bones are very strong, muscles are also relatively strong, and the weight is contributed more by, in those instances, by the bone and the muscle rather than by the fat. Where the BMI is again high, but that BMI will not have the same connotations in terms of the increased risks that we talked about, which is to do with excess body fat. So there should be some method of knowing how much of the excess body weight is because of fat, and we have some measures. Again, these measures, relatively simple instruments to measure would be a bioelectrical impedance, which is, of course, not available everywhere, but it's not a very costly instrument either, which gives us some idea of the amount of body fat a person has. And if you want to know what is normal, well, again, it's defined differently according to what age you are in, whether you are a man or a woman, and also which part of the sort of world that you are from. But roughly for our people, roughly I can say the figures will differ a little bit from here to there, but you can take it that if for a man the body fat percentage is 25% or higher, for a woman, if it is 30% or higher, then this is excessive. That apart, there are more complicated methods. So this body, the bioelectrical impedance just requires you to sort of stand on something and hold on to a handle, and then you have to put in the height, and that the instrument can give you all these details. Other methods could be a DEXA, the dual energy X-ray absorptiometry, which is more often used for assessing bone density, but that can also give us an idea of body fat. And there are other more complicated, more costly methods to go in. So these, of course, need not be uh, undertaken by everyone. But what we really need to do as a society is to improve our health, not just as individuals, but as society itself. And that, I think, the principles are simple, but sometimes becomes difficult to follow. to have a healthy diet, have a regular exercise, have enough sleep. So, adequate sleep is also important for health overall, also for decreasing the risk of obesity. If you have poor sleep, that also is a sort of risk factor, is an initiator of obesity. So it's not just you have to exercise, you have to also sleep well, sleep on time, and also keep your mind. We can't be stress free, but try to mitigate your stress, have your own detoxification methods with you. If you have a stressful day, have something, 15 minutes, half an hour to yourself at the end of the day to sort of rejuvenate yourself, detoxify yourself. Whatever recreation you can think of. So all these, I think, will help us all be healthier individuals and contribute better to our society. And I think endocrinologists, of course, have a very important role to guide individuals, other physicians as well. But we should first try and make people healthier so they don't need to see any doctor. Who
Yes,
wants to see a doctor?
right.
If you are not well, then of course we are there to help.
Sir, one last question. This is an important question also. This is more towards this females. So it is about the PCOS, polycystic ovarian syndrome, which is more common in obese females, but also in lean individuals. There is another entity called PCOS. So can you please elaborate a few words on PCOS and obesity and how to prevent that also?
Yes, PCOS, which is the short for polycystic ovarian syndrome, is one of the commonest endocrine disorders in young women, and where the cycles become irregular. There are issues of excess body hair in unwanted areas, in the mustache area, in the beard area, and so on, which leads to cosmetic issues, embarrassment, and also irregular periods. And then, of course, in young women, there'll be issues of fertility as well, difficulty in bearing child. So this has increased tremendously in recent times, partly because of greater awareness, but partly or significantly because of significant increase in obesity in our population as well, in the young population. This is basically because with obesity, with excess fat, with excess of bad fat, as we discussed, there is insulin resistance. The hormone insulin, which does a whole lot of good things, that hormone cannot act appropriately, properly. And that, on the one hand, can give rise to diabetes. On the other hand, it can also give rise to polycystic ovarian syndrome. So this has to be treated in the first instance by adequate weight management, diet, and exercise, and then of course has to have some assistance of medications in some instances at least. Now, while I did say that it's because of obesity there is insulin resistance, but we also do see non-obese or so-called lean women or girls with PCOS. That is because they also have similar amount of insulin resistance, partly because of genetic factors. They are more insulin resistant, even if they are not significantly fat. So for them, so the amount of fat one may have is partly uh, sort of genetically determined. So for me, maybe 20% is the limit. For someone else, maybe even 18% is the limit, and then 20% or 22% could be abnormal. So for those individuals, for our easy understanding, I would say is for those lean PCOS, possibly their set point for the normal level of body fat is lower. So if you exceeded that lower target itself, then you get insulin resistant. So that possibly explains why even some lean girls or women can have PCOS.
Thank you so much for your valuable time, sir. Taking time out of your busy schedule to enlighten us. Would you like to add any message?
Well, the message, I think, obesity theoretically should be very easy to control. We only need to get the energy balance on the negative side, but it's very difficult to practice on a long term. I have, I mean, any patient that comes with obesity and we advise them lifestyle measures, it's common to see them lose a few kilos, 5 kilos, even 8, 10 kilos, even in the next 3 to 6 months. But thereafter, it is very common for them to be attracted towards the same old lifestyle that he or she was exposed to. Society drags them along. So you do the same things that you have been doing. And so you gradually gain back the weight. So at the end of 1 year, it's not uncommon to see the weight almost the same as what they started with. So that brings in the necessity possibly of using medications also in some individuals. But having said that, there are several individuals, several of my patients, and I'm sure you have seen patients who have lost weight, who have maintained it over the years. So it's not that everyone has to have a medication just because he or she is obese. We need to remember the healthy lifestyle. And even if we do not lose weight, regular physical exercise has its own benefits. So that is something I think as a nation, we are not so physically active. We may all complain. Most of my patients say, where is the time I go out for a walk in the morning, come back so tired in the evening? Which is true, but if you look at it, the day, most of the time is spent in sedentary work, very little physical activity. So I think one mantra that I could give to our esteemed Prime Minister is to make the nation more physically active. That will solve a whole lot of our problems in the future. So, with these, I would like to wish all a wonderful week ahead, a weekend first, and then a week ahead. And thank you very much, Andres. It was so interesting. Thank you for posing those searching questions. I hope I didn't disappoint you.
No, no, sir. It was really
Yeah,
wonderful to
yeah, yeah.
have spent the time with you.
Yeah. Thank you.
Thank you, sir, and good night, sir.
Thank you. Good night.